Sub-Saharan Africa frequently gets the bad rap for the treatment of children, but that may be changing. Joining us today is Rebecca Davis, Director of the Center for International Social Work at Rutgers University, under the banner of Reshaping Child Protection. What's changing there?
Well, in Sub-Saharan Africa, the profession of social work is gaining a lot of visibility. In Nigeria and Malawi, where I'm working, but more generally in Sub-Saharan Africa. And also, many countries see that if they're really going to deal with the poverty, with the what's happened in Africa with HIV/AIDS, they're going to have to build the child protection system.
How happened you picked Nigeria and Malawi?
Well, I guess they kind of picked me because I've been, most of my work started in Central and Eastern Europe after the fall of the Soviet Union. And over the last few years, as the health systems have been growing, then I was asked to really do a study for Sub-Saharan Africa, all of the countries, looking at the child welfare system, and particularly around the workforce. So because I'm in education, Nigeria and Malawi look at strengthening the child protection system by building their education system. So in Nigeria, they have schools of social work, but they want to strengthen it. In Malawi, there is no degree program in social work, so we're starting at the very bottom. So I think part of it's because of the focus in terms of building education. You
know, with so many resources here in the U.S., is it frustrating? Do you get a sense that Americans are not as connected with what's going on in Africa as perhaps we could or should be?
I think that, yes, I think part of it is that there is this perspective that we need to take children out of Africa. We can provide better for them here. But if we're really using the philosophy that we also use here in New Jersey, that children belong with their families in their own communities, then we really have to go and build those systems. So, and I think also that really understanding that it's not just about poverty, but people that live in poverty have tremendous strength and tremendous caring for families. So I think that's the story that really has to be told.
Is social work perhaps on the front end of this? I mean, do you feel like you're at the tip of the spear, so to speak?
We're getting there. Social work, the whole kind of public perception of social work is not very positive. There's not a high profile of social work. And one of the issues in Africa, because of the many years of colonialism, social work was imported from Western countries. And so social work has really lost the community connections that were in our early days of social work when Jane Addams was working in the settlement houses.
Sure.
So we really that's part of the work, is building curriculum that teaches potential social workers, community workers, what they need to know to work in Sub-Saharan Africa. We use the term indigenize. We have to indigenize the curriculum. And I think the other issue that's very unique is that in Sub-Saharan Africa, you have a customary law and civil law. So, which
are sometimes in conflict.
Exactly, exactly. And some of the traditional practices are harmful. But we really have to build some of those community connections and link those two. And that's where social work comes in.
Right.
We know how to indigenize and, work on the ground and make things work.
A lot of this has been associated in prior generations with religious orders, either nuns from the Catholic Church or Indian groups. How do you take that and apply it to the general population to get more interest here in America, to get more resources there?
Well, I think we just have to tell the story. I mean, I think we really have to, one of the things that we're doing at Rutgers, I think, is really developing international service learning programs to really build a linkage so people can go and visit and provide service. I think the other is linking, there are a lot of wonderful nonprofit organizations that are providing services on the ground for little or nothing. It might be the parent of a disabled child that says, I need to build something. And I think linking some of those resources that we have here with there is what is really needed.
And certainly doing it through student groups helps as well.
Yes, yes.
Rebecca, a pleasure to have you.
Thank
Hope you'll
you.
come back and talk to us
Okay.
more as more of your program develops.
Thank you.